So with that, it is just my pleasure to introduce Jessica Wilcox, the Food and Nutrition Services Manager at Livingston Healthcare, and Dr. Alison Harmon, Associate Professor of Foods and Nutrition and Sustainable Food Systems at MSU. And they will be presenting on recent research done on sustainable food service in rural hospitals in the state of Montana. So
thank you, Katie, and thank you, NCAT, as well, for organizing this conference. This is a great diverse gathering, like Katie said, and I think it's really a pleasure to get to talk to this audience, many of which I know, and it's just great to see you, and some of whom I don't know, and it's great to see you too, because that's kind of why we're here. So I just wanted to say, before I started, so I've been at MSU for 11 years now, and Jessica was my very first graduate student to graduate. So I forget that sometimes because she's just so awesome. She's like out there, doing awesome stuff, and it's a pleasure to get to present with her 7 years later. So, and to fellowship papers 7 years later too. Anyway, we'll go on. Yes. So just a little outline of what we're going to talk about today. We will focus first on the food system and sustainability, and I know a lot of you are really very educated about that, so I won't dwell on that piece. But then the role of food nutrition professionals, rural hospitals, and hospital food service. Take a look at Montana's food system and rural landscape. Look at a case study of Livingston Healthcare. And then I will talk about some research that was done by Jenny Montague, who is also listed on the front slide. She was another graduate student who graduated a few years later than Jessica. And the research I'm going to talk about towards the end was the topic of her master's project. So I wanted to acknowledge that Jenny was part of this project. Okay, so I don't think we'd be here if we thought everything was going swimmingly. So I'm going to just mention that we do have some issues in our food system that contradict sustainability. Consumption of resources, conversion of agricultural land, declining farmer incomes and agricultural profitability, consolidation in the food industry, an enormous amount of food waste, about 40%, according to research, declining genetic diversity in food crops, pollution resulting from synthetic agricultural chemicals, runoff, and then health problems that are associated with our industrial food system, like antibiotic resistance, foodborne illness, exposure to toxins, respiratory illness, obesity, malnutrition, other diet-related diseases. So if you read the paper that we handed out, the first part's a bit of a downer, and this is what it's about. So if you want to dwell on that, you can read the paper too. But I want to move on, if that's okay, to some more positive things, I guess. Okay. So if we're aiming for sustainability, I just wanted to offer a definition that a sustainable food system would conserve and renew natural resources. So this bottom layer of our food system here, if you can see that conceptual diagram. Advance social justice and animal welfare. Build wealth in communities as opposed to concentrating it in corporations. And then fulfill the needs of all eaters now and in the future. And a lot of you today are food nutrition professionals, so I wanted to talk about why that's important and what the role of food nutrition professionals is in this. If we're aiming for sustainability, then we need to take an active role in reshaping our local food systems. We have to start imagining ourselves as part of the systems that we're affecting and as pieces that make decisions that make a difference for everybody else. So I think we can work on policies, both at the local, state, and national levels that are going to link agriculture and health. I think we can connect consumers to healthful, whole food choices, encourage low-input agriculture with our procurement decisions, and improve agricultural profitability for small-scale producers. So this is where I want to mention the Montana Dietetic Internship, because this is a program at MSU that is striving to connect dietetic professionals with the food and agriculture system in the state. So this is actually part of our first class at MDI, we call it. And they're taking a tour at Mark Rader's farm. So how do we encourage low-input agriculture? How do we improve agricultural profitability? By getting to know farmers. And so if you're a food nutrition professional, you have farmers here to get to know. And I think that's one of the first steps, is to start developing those relationships between professions across the food system. And Colleen Kaiser is here. Can you raise your hand? So Colleen is the director of this statewide program for MSU, and you're going to hear, I think, more today about what dietetic interns do in the state, but if you have interest in being part of that program in any way, connect with her today or later. Okay, so what can we do with local food systems? Well, we can contribute to a reduction in food safety risks, and I think we can do that not by denying that risks exist on a local scale. Let's get over ourselves and realize that we have things that we need to do on a small scale, a local scale, to reduce food safety risk. We need to be proactive. We need to get GAPS training. We need, as producers, we need to connect with health inspectors. Are there any health inspectors here today? Somewhere. Okay, there will be. And and vice versa. Okay, so health inspectors need to understand agriculture and the constraints that we have in small-scale agriculture. There are some things that affect food safety that are out of our personal individual control as producers, and those things we need to work on with policy at the state level, like water quality. We all need that, and that's not something that should be put on the small-scale producer. We can conserve agricultural land, preserve environmental quality. Importantly, increase the availability of healthful foods that are fresher, less processed, and have more nutrients because they're fresher. Connect dietary guidance and obesity prevention with all sectors of the food system, so that our health problems are a factor of how we produce foods, how we process them. 25% of Americans live in rural areas. Rural communities rely on their hospitals as components of the regional economy. Rural populations are older, they have lower incomes than urban counterparts. Rural hospitals are smaller, less financially stable than urban counterparts, but rural hospitals can link support for local economies through local food procurement with providing high-quality health services and nutrition, too. So a lot of potential to make a difference in rural hospitals. So this is according to some literature review of current research. Hospitals, we know, can be a source of environmental problems. It makes sense to participate in conservation measures. It makes economic sense. It makes ecological sense, too. You save money by conserving water and by reducing garbage. Food changes, according to the literature, are the most challenging changes to make in a hospital food service. So that's one of the things we'll focus on today. Okay. So localizing the procurement of hospital food. I'm not going to dwell on the reputation that hospital food has for quality. It's a joke, and I think we got to get over that too. Let's move beyond that. Hospital food should be bad, and let's focus on how we connect it to promoting health. So by localizing procurement, we can improve the quality of what we offer. We can address the hospital's mission. We can promote patient health, promote community health, and a good strategy is to connect with community-supported agriculture. And that's probably not being done enough, although I think there are some leaders in making those kind of initiatives. So once again, from existing research and literature, this is a list of recommendations for sustainable practices in hospitals. Recycling, composting, reusing, particularly recycling things like cooking oil and grease, purchasing green products and following more environmental cleaning practices, using a green pest control or IPM, using, if necessary, compostable or bio-based single-service items, organically, locally, or sustainably grown food products, seasonal fruits and vegetables, ethical and environmentally sensitive animal product sourcing, tap water versus bottled water, reusable beverage containers, and then using labeling and signage to educate patrons. So a little bit about Montana and putting that into context, giving us some perspective on where we're sitting, because it's easy to forget when you're just here and you don't travel to other places a lot. So Montana, the 4th largest state, but population-wise, we're the 44th. 55 out of 56 counties in Montana are defined as rural. 45 are defined as frontier counties, which means there are less than 6 people per square mile in those counties. Montana is the second in land devoted to agriculture nationally. 1 million people, approximately, 3 million livestock. The agriculture industry is a $3 billion plus industry, but it ranks 31st in the nation. Important crops: wheat, cattle, calves, barley, and hay. Yes, agricultural profitability has declined. Annually, we spend about $2.6 billion on food, and only $6 million on food directly from farmers. So that's only $6 each on average on direct from farmer purchases. It's not very much. That means that we could actually make a really big difference, I think. Our emphasis in agriculture is on export, so we have a relatively weak transformation sector, so a lot of potential for changing that. And then we historically have lost some food self-reliance, so we used to produce a lot more of what we eat than we do today. Okay, so per capita income is about $38,000 to $39,000. That ranks us 45th in the nation. Our GDP is 48th in the nation. A lot of our rural counties are characterized by high poverty. We have limited health care options as a result. Chronic disease-wise, our numbers are very similar to national averages. Healthcare is an important industry in the state as far as employment goes, so 18% of jobs related to healthcare in the state. Aging population, like everywhere. By 2030, about 25% of Montanans will be over 65. And then we have critical access hospitals. 48 out of our 65 hospitals in the state are defined as critical access hospitals. That means that they're 25 beds or less. It also has some implications for reimbursement for services. So we get a little bit more, say, from Medicare, than a little bit more than 100% of costs reimbursable by Medicare. 24-hour emergency care. So that's a critical access hospital. And critical access hospitals were the subjects of the study that Jenny Montague did, so I wanted to make sure I could find them. High level of social capital in Montana County, so that's a big plus for us. So I'm going to turn it over to Jesse now, because Jesse's case study really supplied a lot of data and information that informed the study that Jenny did.
Okay. It is so nice to see everybody here today. Thank you so much for coming. I feel like I know half of you, and I'm so thankful to see you, and then I don't know half of you, and I'm so thankful to meet you. So my name is Jessica Wilcox. I am the Food and Nutrition Services Manager at Livingston Healthcare, and I'm also a registered dietitian. So my role currently at the hospital is I manage the kitchen, And right now I have a staff of 7. When I'm fully staffed, I have 10. And then I also do all the clinical nutrition counseling, inpatient, outpatient, oncology, cardiac rehab. And then I do things like this. So Livingston Healthcare's mission is serving through quality care. We are a critical access hospital. Another reason why we're designated critical access, it also has to do with location. Critical access hospitals have to be at least, I think it's 26 miles from another, or maybe it's, 30 miles from another healthcare institution. So it's affecting those rural areas that don't have access to that emergency care. The reason why we count in Livingston, because I think it's 30 miles is the designation. We're 26 miles from Bozeman Deaconess, but we have a pretty hairy path that you would have to get over if there was some bad weather. So that's why Livingston Healthcare has that designation. We're 25 beds. We do not have a long-term care facility attached to us. Some critical access hospitals do. So our average daily census is 11. That's not a huge population of inpatients typically. We have 330 employees though, so we are considered the largest employer in Park County. So that alone says quite a bit for the importance of keeping Livingston Healthcare around. Critical access hospitals are facing a bit of scrutiny these days just because of Medicare and all the changes that are going on in healthcare. So we are very fortunate to still be in business and being the largest employer, thank goodness, for our county. So having an average daily census of 11, we serve about 150 meals per day. I'm happy to report that number is going up. 5% of those are patient meals, so the rest of that is actually for staff and guests. And so I would say the majority is really for staff. We're feeding our own over there, which is great. And I think what I'm going to do, I'm going to tell you this story, and I feel like I've told this story about 100 times, and some of you, I'm sure, have heard this story 100 times, but we're gonna tell it again. So I started in 2007, and when I started, I was a recent graduate from MSU with my master's degree in health and human services. When I started, I had a staff of 6. The majority of that staff had been there for a decade or more, so they had been there for a while. And the type of food that we were serving here on a 10-day cycle menu, so every 10 days the cycle would start again. And it was all ready-to-be-prepared foods, mainly those lean cuisine and Stouffer's aluminum foil type dishes. And the dietitian before me really thought that was a great service because it's something that the elderly folks in town could head over to Town and Country or Albertsons and pick up. So the food would be familiar to them. It was easy for them to prepare. It was very soft. It was kind of like casserole, so it was, chew and swallow friendly. We had a lot of Jell-O desserts. We had a lot of egg salad sandwiches. Kind of the, maybe back then, perhaps typical hospital food. And so here I am, this recent graduate of MSU, and I'm from the East Coast, so I'm from a totally different area of the country, different food, different flavors, and I end up in rural Montana, and it is meat and potatoes. And I really felt strongly about getting rid of that processed food. I really didn't like the amount of sodium, the amount of saturated fat, cholesterol, just the concept to me was off. So much to my staff's dismay back then, I started eliminating those and asking a lot more of them as far as labor. These guys hadn't had to pick up a knife in years. Literally, they just didn't have to chop or dice or slice. And it wasn't their fault, it was just, that's the way it was. So, here I am all enthusiastic and raring to go, and they're like, hold on, lady, you are crazy. Like, I can't believe you're asking us to do this. Like, I can usually take a 20-minute break, 30-minute break every other hour because there's really not much to do. And here I am saying, no, let's do some baking, let's do something creative. So, quite a few challenges in the beginning. And I'll say, to be honest, I don't think getting the food into my kitchen was the biggest. It was really more so trying to convince my staff that this was the right thing to do, to convince the rest of the hospital, my customers, that this is the kind of food we should be eating. You know, I put gazpacho out and they thought, you know, it was some spicy salsa. And so things that I was coming to the table with something totally different than what they were used to. So, of course, safety and sanitation is always a concern in any sort of institutional food service. And so we were going from these ready prepared meals, which is all just nice and packaged, to getting these whole foods in. They had to deal with raw meat now. They had to deal with, you know, dicing and slicing vegetables that were whole. We had to talk about, you know, how quickly did things need to cool. So huge learning curve from a production standpoint. And then culinary skills, again, I had some people that really, they had no knife skills and they really didn't need them. They didn't have any sauteing skills, they didn't have any, you know, that garnishing, you know, making a soup from scratch, none of it was really in their repertoire. Or if it was so long ago and they hadn't had to use that skill in so long that they weren't up to snuff. So it took several years of getting in the kitchen with them and cooking side by side with them and convincing them to try what they made, because that was, you know, I was asking them to create dishes that they probably would not eat at home. They weren't sold on eating it there. The customers coming through the line were not sold on eating it because it wasn't what they were used to. It took a lot of convincing. It took a lot of free samples. It took a lot of, please give me your recipe and I'll see what we can do. But as a dietitian, if you give me a recipe for chicken pot pie that has a lot of butter or, you know, using ingredients, white flour maybe, I'm going to tweak it. And we're going to use different sources of fat, we're going to use different types of flour. And so then they were like, hold on, that's not my chicken pot pie. What'd you do to it? You messed it up. So then I had to convince them to try that. So getting staff to buy in, getting the rest of the hospital to buy in. This wasn't something that my administrator asked me to do. They did ask me to actually change the food because that 10-day cycle had been in play for 6 or 7 years. Same food, same lean cuisine or Stouffer's dish, chipped beef over toast, same stuff for 6 years at least, and they were getting tired of it. So that's what the administration asked me to do. They didn't ask me to necessarily start a local food program. They didn't necessarily say, please start doing things from scratch. They just said, please change it, because we don't want to eat there. So, convincing those folks, you know, and then things that come with that, you know, we started with just one product. And if there's people out there who aren't using local foods yet, but are thinking about it, just start with one. Beef is a great one, because everybody likes it pretty much, and it's everywhere in Montana. So we started with one, we started with beef. And then we started with potatoes. And then we started branching out, and we got catalogs from Western Sustainability Exchange, who's a nonprofit that's based here in Livingston that really supports that connection between local sustainable producers and buyers. My county sanitarian way back then was the one who hooked me up with the beef producer. So she said, you want to go local? Awesome. I know the Inderlands over in Big Timber. They'd love to sell to you. You should go over there. So my sanitarian was the one who really suggested that in the first place. I've had 3 since she retired, but they've all been different. And you're going to meet the Craig County Sanitarian this afternoon, who's fantastic. So when you start to really build up this repertoire of producers, then you've got to start dealing with more deliveries. You've got to deal with multiple orders. I'm always trying to think about, okay, who's new, who haven't I used yet? How do I branch out? How do I add more? Sometimes I've got time to do that, sometimes I don't. I feel like I got to get back into it. I feel like I've let that slide lately. But those are some of the challenges we've had, and I think really my real challenge was getting that staff and getting that hospital to buy into the changes that I was making. Okay, that was 7 years ago. So now, so many successes to celebrate. And again, I've been giving this, I feel like I've been giving this presentation for a while. I'm so fortunate to be able to speak across the state about this. And even this morning, when I was thinking about giving this presentation to you all today, 6 a.m. I write my staff this email, and I said, we did it, we're doing it, you're doing it. Thank you so much for sticking with me in the last 7 years, because I've thrown you guys through the ringer, and you're still with me, and you're still doing it, and I couldn't be more proud of it. 6 a.m. Maybe I had too much coffee, I did at 5. So anyway, here's some of the successes. So I had 6 when I started, and when we were going from already prepared to pretty much completely scratch, that takes a lot of labor. So at the time, 2007, 2008, our economy was doing pretty well. So I was allowed to hire 4 more full-time employees. So we created 4 more jobs in that kitchen. And when I brought these new people in, I really, I was looking for people with a passion for good food, a passion for the culinary arts, a passion for health. And funny enough, they clashed entirely with the 6 people I already had. That should have been on the challenges page, but anyway, we created 4 more jobs, which is excellent. And then the social justice piece, in trying to convince this group of people that this was the right thing to do, we had education sessions twice a month, either from a nutrition topic to a sustainability topic. We showed movies like Fresh. I had staff fall asleep. I'm like, I'm paying you to be here. Can you just sit through this and bear with me? But they did, and they put up with it for a long time, and we're still doing this. But then the food that they had access to and that they were exposed to and the skills that they were learning, whether they knew it or not back then, they were valuable. And now they can all wield a knife, no problem. They can all make a soup. They can all follow a recipe. So whether they've implemented that at home, I don't know. I think some of them have. I had a couple employees who actually, each woman lost over 100 pounds over a course of 2 or 3 years. It was significant. So that in itself was well worth it. And then my patients, my coworkers, they've got access to some of the best food in the state. So that's a great piece to this whole story. And then we were so fortunate to win the 2012 Innovation Healthcare Award. So this is an award that the Montana Hospital Association gives out once a year for innovative projects that hospitals have come up with over the past year. I don't think there has ever been a food-related award for that. So I got to go to Billings, and the Montana Hospital Association conference is really mostly hospital administrators, CEOs, kind of the senior leadership tier of hospital employees across the state. There's certainly education sessions for nursing and clinical. There's very little for RDs that I've seen in the past. I did give this presentation there once a couple years ago. There were 3 people in my audience. That's okay, they came, it was fun, it was great, I know. But that was way before 2012. But it was so amazing to me to stand up in front of all those hospital administrators and CEOs and people I know who are working in hospitals across the state who said, I can't get anywhere with this local food thing. And to stand up there and say, we're winning an award for our local food program. That was huge to me. So that was what I thought our real first exposure was to the rest of healthcare, just showing what we've done and what we've done successfully. And then we won a couple of EcoStar Awards, which is awesome, through MSU Extension, and we have a pretty thriving sustainability program as far as recycling. We started a recycling program in 2007. The hospital wasn't recycling anything back then, and we are now. We even recycle some of our food. It's not necessarily composted, but we have a aquaponics farmer in town. It's the neatest thing, but we give them our cooked food scraps, and they feed those cooked food scraps to these flies, and then the flies have larvae, and the larvae actually climb up this little ramp, fall into a big fish tank, and those fish fertilize the plants, and then they sell their plants to us. Yeah, so we're doing some cool things. Okay, so public and environmental health. I know it's such a weird story, but they're great. They're right in town, and they're fantastic. I'm kind of wishing they were here today, but they're not here today, right? Okay, so public and environmental health, just to be able to bring that tray of food into a patient's room, pull the lid off, have it look delicious, and it does. Our food looks delicious. Promise. And just be able to tout that to a patient and have the patient be like, wow, this was really delicious. Thank you so much. Because it's the best part of my day. Otherwise, it's CTs and MRIs and shots and IVs and all those other things that happen in the hospital. And so really, getting your meal can sometimes be the best part of your day. And then environmental health, certainly our sustainability piece is big. Just trying to really support local agriculture. I really try and prioritize Park County as far as my buying is concerned, and then we definitely branch out from there. And we certainly do regional. I mean, I count that in addition. Employee engagement, education, empowerment, just like the email I sent out at 6 a.m., they did it, and nobody quit. I can't believe it. They're still there, they're hanging in there. Actually, one woman is retiring today. It's her last day of her 13 years. I have a picture of her. So she left. She's leaving today. But they've learned so much. They have come so far. Not only the staff in my kitchen, but the staff throughout the hospital. And our numbers are going up big time. So increase in cafeteria sales. I had to set a goal last year. And my goal was to increase my cafeteria sales to staff specifically by 500 or 450 meals a year. And we were up well over 1,250. So awesome. And just last month, we were 469 meals in a month. So for a critical access hospital who really needs to get revenue in the door, that's a big deal for my little non-revenue generating department, quite frankly. And then increase in patient satisfaction. Patients like our food. You can't please everybody 100% of the time, and I think a lot of people come in with that perception that hospital food is going to be awful, so even if it's not, I'm going to tell you it is, and that's okay. But for the most part, people are very satisfied with our food, and their families are very satisfied with our food. And then one of the best things also is just the networking and making friends, which most of you are in here. Over the course of time, either from buying or visiting your farm or your ranch, or buying from you, or seeing you at a conference, or having you as an intern, or working with you in one capacity or the other, it's a big deal to network. And you guys are going to hear a lot about how we network in Park County with our Park County Food Systems Council. But it makes a huge difference, and it makes it so much easier to pull off the things that we pull off. So I encourage you to meet new people and really network in your own communities. And that'll be a big push of that panel discussion this afternoon. Okay, so we do have some exciting things in store, and I'm not going to go into this very in-depth here because we're going to take a tour. Hopefully most of you guys can come this afternoon to our current facility, but we are building a new facility, and it's been great because I've been very involved with working with our kitchen designer, and him trying to figure out what the heck I'm trying to do, which is very innovative and very different from our current model. I don't want to be typical cafeteria hospital food anymore. I want to do something totally different. And I think we're going to. Now we have to keep our fingers that I can actually pull it off. But we are getting a new facility. It's east of town, so if anybody's driving east on the way home, after you cross the 89 bridge, it's the big building on the right. So we're pretty excited about that. That should open next fall. And then we're changing the cafeteria model. We have plans for an edible landscape. So I want fruit trees, I want berry bushes, I want a garden plot, I want a greenhouse, I want it all. And I don't know how we're going to get it, but we're going to try really hard. And my CEO, who is new as of a couple of years ago, is very supportive. So we're looking for grants, we're looking for funding, we're looking for all sorts of things to make those things happen and make it a very beautiful backyard. And the location of our new facility is absolutely stunning. It's right along the Yellowstone River. It's got views of Livingston Peak. It's a bit outside of town, but not far. And for those of you who are coming this afternoon, we're smack dab in the middle of a residential area. And we're totally spread out. All 330 employees are within a 6-block radius. So we are not all under one roof, but we will be. And so thinking about serving 150 meals now, and there's maybe 125 people that actually work in the building that we serve out of, we are all going to be under one roof. So I can't imagine, I'm really hoping our sales are going to go up. And then I really want, with this design of the kitchen, to explore the culinary arts and really feature those, because I think from a dietitian's perspective, we really got away from cooking from scratch. We really got away from whole foods. So here we are teaching food labels and, microwave cooking and all that stuff, which really does coincide with how busy we are as Americans and, working and family and whatever else obligations we have. But honestly, we've got to get back to our roots, and we've got to get back to cooking and dicing and slicing and spending some time in the kitchen when we get home from work. And even though maybe we just want to sit down and put our feet up and eat a McDonald's shaker or whatever, we have to get away from that. So with the design of our new kitchen, I'm really hoping to feature some of these talents that my cooks and chefs have gained. Okay. Here is a mock picture of what what Livingston Healthcare will look like coming up pretty soon. And then, as promised, this woman, her name is Barbara Bretsch. She retires tomorrow or today after 13 years of working with me. Joe Bergdahl's on the left. This is the Livingston Food Pantry's community garden. We had a garden plot there for a few years, and then we really just could not keep up, to be honest, to get staff over there to volunteer. But this was a couple of years ago. Barbara is not wearing gloves, I want you to take note. When she started, she refused to touch dirt. And that, it takes all kinds, honestly. And I was like, what do you mean, Barbie? She's like, I don't want to go, don't make me go. And I did, I made them all go. I made my entire staff at least go down there and spend a little bit of time either planting or weeding or whatever, and many of them didn't want to go. So just go and stand there at least, just go and look. And Barbara would not go unless she had gloves on. She would not touch dirt because it was dirty. And then after several weeks of doing this, there's Barb, no gloves, and I was so proud of her for getting over that dirt phobia and getting her hands in the dirt and doing some weeding. So there they are. They're out there picking spinach and whatever else they're up to over there. So, okay, so that's my spiel. I'm going to turn it back over to Alison. She's going to give you the survey results and the results of the study.
So you can see, I think, why we chose Livingston Healthcare as our case study to base this survey on. And this is the survey it's actually in total in that paper if you want to see what all of the points were. But I'll just summarize by saying it was in 3 parts. The first part had to do with patient numbers, human resources, information about vendor contracts, and local buying patterns if they existed. Second part was about the infrastructure in the kitchen and the processes related to scratch cooking, menus, equipment. Part 3 was about knowledge and attitudes and perception and interest. So that's kind of how it was outlined. Okay, so we chose hospitals based on their geography. We wanted to get a good geographic representation in the state, and the list of hospitals is actually in the paper, but I didn't want to necessarily go through that in this presentation. But they were scattered throughout the state, not much in the center of the state. Okay, so what about these hospitals? Average number of employees was 11, so these are very small institutions. Number of meals served per day, 20 to 450. So you can see why that's a significant accomplishment at Livingston Healthcare to be serving more than 450 meals in a day. Half of the hospitals were attached to long-term care, so that means half were not. In some cases, the hospital food service was also providing meals for another institution, like a city jail. The average length of employment, 9 years. The people who were participating in the survey, which the survey was an interview, by the way, it was a long interview. Managers, some were RDs, some were diet technicians, some were certified dietary managers. Half were purchasing cycle menus directly from a food vendor. The other half were writing their own. And so they were writing their own menus in 6-day to 4-week cycles. Some had cafe-style menus, and they were changing them seasonally. The vendors included Cisco, FSA, US Foods, and then there were secondary vendors as well. So some challenges, and these will be familiar because you just heard some of the challenges that Jessica had to address too. So no policies in place related to purchasing local or sustainable food. Some administrative hesitance to institute policies that might have financial implications. The kitchen equipment needed to be updated. There were some anticipated increase in costs and workload, although as you can see from Jessica's example, it's not always the case that costs go up. Sometimes you end up saving a lot of money by doing this. Changing the hospital menu is difficult because of taste preferences of patients and staff, and the need for staff training in the kitchen, education about the rationale. Once again, you can see, yes, of course, that's a challenge. Lack of power related to decisions about purchasing, particularly of environmentally friendly supplies. Uncomfortable with food safety risks. So there's a lot of uncertainty about what's safe to do and what's not regarding purchasing local food. Perceived constraints of the health inspector. So these are just perceptions, right? It's not necessarily realities. These are perceptions. Inadequate delivery options for local food, lack of consistency of local products, and then sometimes a limited resource or limited knowledge of the resources that are available to help. But I'm very encouraged by the opportunities that came out of the study too. Overall, of the managers that were surveyed, there was very strong interest in local purchasing. I think this comes back to that social capital in rural communities. So strong interest. Yes, I want to support my community. Of course I do. If barriers are addressed. So there's some issues to overcome. On average, institutions were preparing almost 80% from scratch. This is a huge opportunity. We haven't lost a lot of scratch cooking in a lot of our hospitals. We're still doing it from scratch, which means that we can do it with different kinds of food. Positive attitudes about scratch cooking. 40% were already sourcing some things locally. Local products included dairy, bread, produce, meat, legumes, flax and oatmeal, and there was one story where one of the hospitals was purchasing an animal or two every year from 4-H, and that was one of their meat sources. So I thought, that's social capital. Directors can identify producers. They know producers. They already have some of these relationships, so it's not a matter of starting with nothing. 40% had gardens or plans to install them, so this was very promising. There was some uncertainty, once again, about can we actually use that food in our food service? Is that safe? So again, some misperceptions about food safety. The majority had somewhat of a flexible budget, so that's an opportunity. 40% were using some kind of environmental products or waste reduction strategies, and there certainly was a strong express support for employees, patients, and community health initiatives. So I think we have a lot to be proud of related to our critical access hospitals. I think that there's a lot of potential there to make a difference and make changes that are positive. So just to conclude, I'd say that we have a lot of opportunity in Montana. We have hospital food service directors that are willing and able to engage in communities by procuring locally. We have staff who still have some scratch cooking skills, and this is important. We have staff and community members that have gardening and food production skills, and we can use this as a way to create jobs by reducing costs in other ways. There are some resources in your packet, so I don't need to spend a lot of time here, and they overlap with this list. And I'll just mention, because we want to save a good amount of time for questions, that some of the curricular programming, if you're not familiar with what MSU has to offer, we do have an undergraduate program in sustainable food and bioenergy systems. We have a graduate program that has an emphasis on sustainable food systems and health and human development. We have the dietetic internship that I mentioned before, which has a concentration, a declared concentration in sustainable food systems, and we're only one of 2 in the country that has that concentration. And in the future, we hope to have a hospitality management undergraduate degree program as well, with an emphasis on farm-to-table restaurant management, rural tourism, agritourism, and value-added food enterprise. So I'm really excited about that. That proposal is moving through the review process on campus and should be considered by our Board of Regents in early spring. So this is another thing that is on the horizon that I think can contribute really to this farm to hospital, farm to school, farm to everything movement in Montana. So I think I'm going to conclude there, and Jessica and I both invite your questions or comments or anything. We have at least 15 more minutes, right? Okay, great. Thank you. Does anyone have a question? Yes, first.
I guess my question is, how are you working with the food sanitarian, the county sanitarians? Because that seems to be where most of the hang-up comes from.
Great question, and that is why ours is coming this afternoon. So I've always made it a very strong point to be very transparent with my county sanitarian. And like I said, I've had 3 since I started. But if there was a new producer that I wanted to use, I tried to make it a point to actually visit that farm or ranch myself. But then I always would call my county sanitarian and say, hey, I'm thinking about buying produce from Montana Roots. Have you been there to inspect their facility yet? Do you have any hang-ups with that? Any problems, any concerns? Have you tested their water? Have you visited their location? Do you approve of me purchasing that? And that's what I've done. And you'll hear a little bit this afternoon. We food service managers go by the Green Book, as well as the Federal Food Code. And the Green Book, that's the established rule for food service establishments in Montana. And when it comes to procurement of food, it simply states, must be from an approved food source, period. End of description, and that's about it. So, I think with the Food Safety and Modernization Act, there may be a bit more guidance as to what an approved food source will be. I don't think it's necessarily going to be in our favor, but we'll find out, hopefully sooner than later. But that's what I really tried to do, is just be completely transparent and really establish a very good relationship with my county sanitarian. And thank goodness I have a fantastic one. His name is Craig Case. He'll be here this afternoon. And just make sure that he is very well aware of the food that I am purchasing, and he has given me that approval. So that's how I've handled that.